Welcome to the Suhail's Paramedical Nursing Academy. In previous class, I explained about vital signs. In vital signs, I explained the introduction of the vital signs. Then I proceeded on first part, that is temperature. In temperature also I explained the first part of the temperature, that is how temperature. What is first body temperature? First I explained what is body temperature. Then I explained about thermogenesis and thermolysis, and also the control of the heat control system in our body, that I told hypothalamus. Okay, the hypothalamus is the heat controller of our body. Hypothalamus is the part of the brain that controls the heat production of the body, that controls the thermogenesis in our body. And I also explained that hypothalamus has two parts. One is posterior hypothalamus, another is anterior hypothalamus. The posterior hypothalamus, one is posterior hypothalamus, another is anterior hypothalamus. Whenever there is change in the body temperature, whenever there is change in body temperature and body tries to maintain the body temperature, then the hypothalamus will be stimulated, either anterior or posterior, depends upon whether the temperature of the body is decreasing or whether the temperature of the body is increasing. Now I am going to continue this part. In this part, I am going to explain about the thermogenesis, mechanism of thermogenesis. I am going to explain mechanism of thermogenesis. What is the mechanism? What is the mechanism behind thermogenesis? How thermogenesis occurs? I already explained thermogenesis is the process of production of heat in our body. Production of heat. How this production of heat occurs in our body? Remember, the mechanism of production of heat in our body is, what is the production? What is the mechanism of production of heat in our body? That is oxidation. That is oxidation of food. This is the important point. Now here is explanation. The important point is the mechanism of thermogenesis is oxidation of food. Oxidation of, what is the oxidation? Now we have to understand what is oxidation of food. What is oxidation of food? See here, we all know. I will tell now. Actually, this part is not here. Here's topic. Now, this part is not the topic of vital signs, but I will give some introduction of this. Actually, this is the part of biochemistry. In biochemistry, where we are studying what? There is one topic, that is respiration. The respiration, that is cellular respiration. Cellular respiration. Remember, in cellular respiration, there is oxidation of food. There is breakdown of food. Which food is there is breakdown of food? Either carbohydrate or either protein or either fat. Either carbohydrate, either protein, either fat. Depends upon the situation. If there is if there is availability of carbohydrate, body will use the carbohydrate. If there is no availability of carbohydrate, then body will use either protein, either fat. Depends upon the availability. See here, I am explaining that there is oxidation of food. Oxidation of food is responsible for thermogenesis. The oxidation of food actually is what? It is in case of cellular respiration, there are food is carbohydrate, protein and fat. These fat undergo cellular respiration. In cellular respiration, what happened? There is you already know what will happen. There is production of energy. You already know there are 38 molecules of ATP in case of aerobic respiration. There will be 38 ATP molecules. So this is a different topic. I have given some explanation how this oxidation of food will occur. Actually, this is the part of respiration. See here, oxidation of food will be responsible for the thermogenesis. Okay, so during this process, one is 38 ATP molecules will be produced. Also, there will be energy. This energy will be the part of thermogenesis. This energy is actually thermogenesis. See here, now I am going to explain. This was the mechanism of thermogenesis. What is the mechanism behind the thermolysis? This was the mechanism of thermolysis, oxidation of food. Now, what is the mechanism of thermolysis? Mechanism of thermolysis. One point I forgot here, that in case of thermogenesis, remember thermogenesis. Remember here, thermogenesis depends upon what? This is important point. Depends on. Remember, if you know this point, it means that you have understood the topic. See here, thermogenesis depends on. Thermogenesis depends on what? Depends upon BMR. This is important point. What is actually BMR? BMR is what? Basal metabolic rate. Basal metabolic rate means the energy required to body at, or we can say the energy required to body when body is at rest. When the body is at rest. Then you know how in body there are a number of organs. There are lungs, there is gastrointestinal tract, there is respiratory tract, there is renal system. All the system require energy. Every system of body require energy to perform its work. So to perform its work at rest, this is called a BMR. How much calories of energy it needs? How much calorie of energy body needs at rest? After taking the meal. In BMR, that is definition. After this BMR we are calculating after 12 hours of meal. After 12 hours of meal. That is also different topic of nutrition. So here I am giving some explanation. BMR. So when the BMR increases, when the person goes for any activities, any exercise, for workout, so what will happen? There the body organs require more and more energy to perform its work. Suppose muscles, suppose respiratory system, suppose lungs, all the organs of body will require energy. So when we are doing more work, more energy will be required for the body. Definitely, when more energy will be required for the body, what will happen? This is called BMR. This is actually called BMR. So BMR has been changed. So it was at the rest. There was, suppose BMR was here. Suppose in case of females, the BMR, one is female in case of male, another is male. In case of female, the BMR is 22 to 24 kilocalorie per kg per day, per kg of body per day. In case of female, normal BMR. These are important points. Actually, I am not going to explain the vital signs only. These important points are required at every situation. Remember, in case of females, the normal BMR is 22 to 24 kilocalorie per kg of body weight per day. In case of male, it will be 24 to 26 kilocalorie of energy per kg of body weight per day. In case of what? In case of male. So here, remember, so this was the normal BMR at rest. So suppose when the person goes for high work, definitely BMR will change. So there will be more requirement, there will be more loss of heat. So thermogenesis will change. So there will be more thermogenesis. This point I explained here, and here I will tell one. Actually, this is an personal matter, and this is also a joke. One day, my grandmother, what happened? One day, it was dinner time, I think. My grandmother was distributing chicken. During dinner time, she was distributing chicken. What happened? She gave some chicken more to my father and somehow less to her daughter. That is, you can call my father or my father's sister. She gave some less to my father's sister, some more to my father. I told to my grandmother, why you are doing this? Why you are giving more to my father and less to? She gave one reason, that she told that your father require more energy. I told why. She told that because he is doing more work. Actually, the concept was basal metabolic rate. My father was doing more energy during day, so this led to the increase in BMR. Basal metabolic rate was changed. So it was at the normal condition. So the person who will do more work require more energy. The person who do less work will require less energy. That is why we are explaining this. There are three types of person. one is sedentary, another is moderate, and another is active. So people are different types. People are different types, depends upon their activities. So when there is more activity, there will be more production of heat. Now I am going to explain. This was thermogenesis. Now I am going to explain mechanism of thermolysis. See here, in mechanism of thermogenesis, there is how heat is lost. It is lost by three organs. One is skin, another is lungs, another is lungs, another is gastrointestinal tract, another is renal system, that is kidney. See here, actually these three organs are responsible for thermolysis. The heat will be lost by means of three organs. See, by means of skin, it is lost by three ways. One is radiation. Second is evaporation, and third is convection, and the fourth is conduction. The fourth part is conduction. Radiation, evaporation, convection, conduction. These three, by means of these four processes, the skin is losing heat from the body. I will explain here. Actually, now there is a point of this point can be asked in any entrance examination. See here, in case of radiation, there is 60% of heat loss. In case of evaporation, there is 22% of heat loss. In case of convection, there is 15% of heat loss. In case of conduction, there is only how much remaining? 60, 70, 80, 82, 90, 97, 3% is only remaining. That is lost by means of conduction. Now I will explain what is actually radiation, what is evaporation, what is convection, what is conduction. See here, actually what will happen? Radiation. Remember one thing, every hot body produces thermal radiations. This is chemistry. This is a part of chemistry. Every hot body produces thermal radiations. Our body is hot body, so it will always produce thermal radiation. When there is continuous production of thermal radiations, there will be more loss of heat. That 60% is lost by our skin by means of thermal radiation. This is the first point. Now the second point, that is evaporation. So in case of radiation, there is loss by means of thermal radiation. Now evaporation. In evaporation, there will be the loss of heat by means of vapors. The vapors can be by means of lungs. When we are doing expiration, there will be the loss of fluid also. There is loss of heat also. So 22% is lost by means of what? Here it is by means of thermal radiation. It is by means of either lungs are responsible or skin. There may be the evaporation through skin. The third point is convection. Convection is what? Convection is the loss of heat by means of air which is around us. So the air current, the air is flowing around us, that will also take some heat from our body. So there will be 15% loss by means of air around us. The fourth point is conduction. When the conduction means what? Loss of heat when there is direct contact with the other object. When our body is with direct contact with our other object, there will be the loss of heat. That is only 3%. Here I will tell that there is a one law in chemistry that says the movement of heat is always from hot body to cold body. This is law in chemistry. This time I don't know which law it is, but I forgot the name of the law. But there is transfer of heat from hot body to cold body. There is only 3% of loss from our body. This has been seen. Now in case of lungs, how there will be the loss of fluid in our lungs? In our lungs, what will happen? See here. See, suppose in kidney, we will go first kidney, because kidney is producing how much urine? Per day 1.5 liters per day. Normally kidney is producing 1.5 liters per day urine. Through this urine, there will be the loss of heat also. Heat loss will be also there. See, this is another important point. And now another point also had been explained here, that is how much urine production is there in a normal adult per day. That is 1.5 liter per day. That is an average value. That is an average value. It can vary. It can vary. But here I am explaining, depends upon your hydration. Depends upon the hydration. So here it is 1.5 liters per day urine production. There will be also heat loss, because that is, you all know heat, that urine is hot. There will be heat loss. Another is GIT. Through how GIT will lose the heat. One is when we are talking. When we are talking, there will be heat loss. And also during voiding. So in case of stool, during voiding through stool, there is loss of fluid above approximately 100 to 300 ml. There is loss of 100 to 300 ml of fluid. When there is a loss of 100 to 300 ml of fluid, definitely there will be also loss of heat there. So this was the another point. Now we will go to lungs. In lungs, it is approximately 400 to 600 ml of fluid. Through lungs, 400 to 600 ml of fluid is lost by means of lungs. There will be also loss of heat by means of lungs. So this was about the mechanism of thermogenesis. This was about the mechanism of thermogenesis. How thermogenesis occurs. Remember, now I will explain what are the factors. What are the factors that affect. Remember, whenever you are listening the lecture, take a notebook, one pen, and write the important pointers, and make your own note in your own way. How you want to write. That depends upon you. See here, I explained that this was the mechanism of thermolysis. Now I will explain another point, that is factors affecting body temperature. Factors affecting body temperature. Factors affecting body temperature. See here, what are the factors that affect the body temperature? First point is, the first factor will be age. How age will affect body temperature. We all know that the newborn has immature heat regulation system. The newborn has immature heat regulation system. And in case of infant, there is also immature heat regulation system, but not like newborn. There is some modification. And in case of adults, there is more modification of heat system. So here, but in case of older adults, when it reaches the older adults, there is, in case of, see, I told that in case of one is newborn, there is immature heat loss, immature heat control system. The immature cannot maintain the body temperature in case of newborn, because newborn does not have so much capabilities, because the body is now not mature. So no, this was the first. Then there is infant. In case of infant also, newborn. Who is newborn? Newborn is between up to 1 week. Up to 1 week, it is called a newborn. Then in case of infant, there will be loss of heat also. There will be also loss of heat, not like in newborn case. In case of newborn, there was more heat loss, but in case of infant, there is some modification. Now there is children and adults. Suppose we will go directly to the adults now. In case of adults, there will be modified heat control system. The heat control system will be modified. And in case of older adults, or we can say in case of old people, there is what will happen? There will be less control of heat, there will be less vasomotor control. What is vasomotor control? There will be less vasomotor control. What is vasomotor control? In case of older adults, the older adults cannot show so much effective vasoconstriction and vasodilation. This vasoconstriction and vasodilation is called as vasomotor activity. So the older adult cannot maintain the vasomotor activities. So in case of older adult, so see here, in case of heat loss, three mostly who are vulnerable to heat loss. One is vulnerable to heat loss. One is newborn and infant, another is older adults. See, this question was asked in one entrance examination. Now I am going to tell that entrance examination. That question which was asked in entrance exam. What was the question that was asked? The question was asked that which of the following, there was 4 options, which of the following is called as silent killer of children, silent killer of child. Which among the following is the silent killer of child? There was 4 options. One option was hypothermia. Remember this point. In case of child, there is more chance of hypothermia. See here, in case of infant, 30% of heat is lost by means of heat. Is lost by means of head. Through head only. Remember, through head only there is 30% of heat loss in case of infant. So we have to, what we should do, remember one point, that in case of small infants and newborn, in case of newborn infants, we should keep a cap. We should keep a cap so that there will be less loss of heat. This is seen in my Kashmir, that we are keeping the always during particularly during winter we are keeping a cap. Even though not only the childs, we adults are also keeping the cap on the head so that there will be less loss of heat. So now I am going to tell another point. This was the one question. Now another point is what? This was about the hypothermia. So now I will tell what is the second factor. First was age. Second factor is what? Second factor is what? Second factor is suppose disease condition. Actually, people prefer the lecture in short duration. I don't know why they don't have time. Actually, when there will be, I want time so that to explain anything. Here, I am trying to take every point to explain here. But what will happen that actually, when a student comes to see any video, that he says that how much time it will take. If it is there is 40 minutes, 30 minutes above, 20 minutes above, he will not see the video because he want for ratification. Remember here actually how disease condition will affect body temperature. We all see when there is infection. Infection means what? Entry of a foreign organism in our body. Any microbe that will induce immune response. Then this process called as infection. When there is entry of organism and affects our body, this is called as infection. So in infection, what will happen? Our body has a mechanism. What mechanism is there? Whenever there is entry particle, our body tries to increase the body temperature. To destroy the foreign particle. Particularly the foreign particle will be microbe, either bacteria, either protozoa, either virus, either prion, or any other worm. See here, during infection, what will happen? Body will increase temperature. Increase in temperature of body. Increase in body temperature. That can lead, we all know that can lead fever. Remember, fever is a good mechanism of body. To control the foreign organism. Because there will be no replication, there will be no transcription, there will be no translation when there is high heat. Then normal value. Bacteria has a normal value for its transcription translation. When there is increase in the body temperature, the bacteria can why there cannot be transcription, translation and transcription, translation and transcription. Why there will not be this process? Actually, what happens when there is increase in the body temperature, the protein is denatured. The protein is or destroyed. The protein is denatured. What is denatured? Denaturation will occur. That means the protein will lose its original structure. Then the proteins will not work. We all know proteins are important for replication, transcription, translation. Okay, so here I told protein denaturation will occur. That is why fever can affect we people also. It can cause same denaturation of our proteins. Actually, it was the good mechanism of body, but it can lead side effect. It can lead complication. So here I told it was about the infection. How now another condition. This was disease condition. disease condition. This was disease condition. Now the third point is hormone regulation. Hormone regulation. Hormone regulation. How hormones will maintain? How hormones will maintain? How hormone system will regulate body temperature? See here. Actually, what will happen that in a hormone system, we all know whenever there are thyroid, there is one gland in our body, that is thyroid gland. Thyroid gland. The thyroid gland produces T3 and T4 hormones. T3 and T4 hormones. Triiodothyronine, tetraiodothyronine. These hormones are produced by the thyroid gland. What they do? They increase BMR. The BMR of the body will increase. Now you got the point. Now you got the point. Why I explained their BMR? That BMR has linked with the thermogenesis. When BMR will increase, there will be increase in the body temperature. Okay, this was one point. Thyroid gland. Another is menstrual cycle. During menstrual cycle, during menstrual cycle, during 14th day. Menstrual cycle is how much day? How many days? 28 days. 28 days. And in 28 days, during 14th day, there will be ovulation. What is ovulation? Ovulation means production of ovum, release of ovum from the ovary will occur during 14th day. That is called ovulation. And during ovulation, there will be an increase of two hormones. One is estrogen. Another is progesterone. And these two hormones will also do the same. What they will do? They will increase the temperature of the body. How much temperature can increase during menstrual period? During 14th day of during ovulation? Approximately 1 degree Fahrenheit. Okay. This I explained how hormones will affect the body temperature. Now I will explain the fourth point. The fourth factor that will affect the body temperature. The fourth is atmospheric condition. Atmospheric condition will also affect body temperature. I will give a simple idea about the atmospheric temperature. When I was in the home during winter, I was using many clothes. I was using the jacket. I was using a Kashmiri dress, traditional dress, that is farran. So because there was very cold atmosphere outside. But when I came outside my Kashmir, what happened in Pondicherry? That there is very high temperature. All over the year, full year. So what happened? That I have changed my dress pattern. We can use only one shirt, or we have to use only one shirt, or only one half shirt, or full shirt, like that. So, but in home, I was using, sometimes in winter, I was using cap also. I was using muffler also. I was using all the things. So this was actually the atmospheric condition. So you understood how it will affect the body temperature. The fourth point is emotion. Emotions. See here how emotions will control. I explained this in previous lecture also, but I will give more idea here. How emotions will control body temperature. Actually, when any person is in depression, when any person is in mental stress, what will happen during depression or mental stress? During depression or mental stress, what will happen? There will be more production of aldosterone hormone, and aldosterone hormone. There will be there is not increase. There will be increase of adrenaline. Actually, it looks like same. So adrenaline and noradrenaline. So adrenaline is also called as epinephrine. Noradrenaline is also called as norepinephrine. So when there is increase of these hormones, they will increase heartbeat also. And similarly, so now you understood there will be hormone imbalance. When there is hormone imbalance, there will be imbalance of heat also. Heat imbalance will be also there. Heat, that is imbalance, body temperature imbalance will be also there. This was about the emotions. See here, One more point I also already explained there in the previous lecture. That whenever patient enters in the hospital, the patient is asked by the nurse. The nurse says to patient that to client that you are going for surgery after 1 hour. What happened? The patient feel anxiety. The patient feel, now what will happen? I am going for surgery after 1 hour. What will happen to me? So what happened? There will be emotional change. There is emotional change. There will be change in vital signs. When there is vital sign change, that may be any change in body temperature. That is, there may be the possibility of fever also. So this was all about the emotion. This was all about the emotions. Now I will explain another point. Another point that is what? Fifth point, that I told what? The fifth point that will affect the body temperature. What is the another point? Oh yeah, circadian rhythm. Circadian rhythm. What is circadian rhythm? We all know that our body has a normal mechanism of sleeping during night time and wake up during we are sleeping during night and we are doing work during daytime. This is our normal mechanism. So what happens during circadian rhythm? When during daytime our body is active. So there will be body temperature. The temperature of the body will be 37 degrees. Suppose 37 degrees Celsius. But what will happen during night time? The body temperature decrease. How much? 0.5 degrees Celsius. That is 36.5 degree Celsius will be their body temperature. So there is decrease in the body temperature during night. So this also affects circadian rhythm. What happened? I will one of the most important point. This point is experiencer point. One of my teacher told me one time that what he told that one patient came to me. The patient was obesity. The patient was having obesity. You all know what is obesity. Okay, obesity means there will be increase in the body weight than normal. There will be high BMR. The BMI, body mass index will be high. The person will be having abnormal body mass index, that is above 30 like that. So what will happen in case of obesity? The patient was suffering from obesity. Remember, my teacher told that when my teacher was diabetologist, he was diabetologist and he has done MD. And the name of my teacher is Dr. Gitandra. What he told that during my this is all about 11th 12th. I am told about 11th and 12th examination during my NEET preparation. He told me that the patient came with obesity. He told that I asked one question. That is, we are saying during assessment we say as for diagnosing anything we are saying history collection. History collection for diagnosis is very important. See how. Actually what happened, the patient was obesity. There was no any kind of disease. See what actually was there. The person was working in any company, and in company the person was doing work during night time and during daytime he was sleeping. This was the schedule of that person. And he told this condition to diabetologist, my teacher. And my teacher diagnosed that this is the main cause that has affected him, that has caused obesity to that person. Now then my teacher told him that you have to change the circadian rhythm. You have to sleep during night time only. If it is only 4, 5, 6 hours, you try to sleep more in night time. Then he done that after some days. What happened after 2 months, 3 months? There was normal body weight. It was because of the obesity. Why I told here? Actually, sometimes circadian rhythm also changes the body condition. So this was all about the factors affecting body temperature. I think I explained everything here.